For this treatment, we're going to assume that someone has a muscle spasm in the upper trapezius, which is a common area to spasm. You can place heat down to begin the treatment for 15 minutes, and then you could go treat the other side as the heat's on the shoulder. This is going to help to calm nerve endings and reduce pain signals, as well as provide comfort to the client. Muscle approximation is another technique that works really well for muscle spasming. Identify where the spasm is, and then if it's in more of a shorter, kind of small area, you can sink in with 2 knuckles on either side of the muscle belly, and then sink in with breath, bring the muscle belly together and hold for 20 to 30 seconds. Gradually release the technique once the muscle has relaxed. Another way to do this is if it's in more of a broader area, you can bring the origin and the insertion together. So with more of a broad hand contact, I'm going to squeeze and bring the muscle belly together for 20 to 30 seconds, and then you can kind of gradually allow it to release back to neutral. Another area that I find really gets a lot of spasming is right kind of in the spinal area, right beside the spine, so the erector spinae muscles. This is going to be more of a finite area, so with the proper body posture, you can sink in with 2 knuckles on either side of wherever the spasm is, and then bring the muscle together and hold for 20 to 30 seconds. By shortening the muscle, you're going to reduce the stimulus causing the muscle to spasm, which helps break the cycle of pain and contraction. Spasms are often the result of overstretching or excessive tension, so approximation reduces the load on the muscle fibers and allows them to relax. So muscle tension often begins at the attachments where the muscle transitions into tendons. Working on these points can help release tension throughout the muscle, and it reduces the neural signals that perpetuate the spasm, calming the muscle fibers and allowing them to reset, reducing tone and spasm. Make little plus signs up by the origin in the upper trapezius by the cervical spine for 20 to 30 seconds. Then go to the insertion point by the scapula and the clavicle and make little plus signs, circular motions, just looking to break up all of the little fibers and adhesions, and do this for 20 to 30 seconds on both the origin and the insertion. By now, I'm sure you guys are sick of hearing me talk about positional release techniques, but too bad. I love them, and this is my course, and I really think you should try them because they work so well for everything. Find the trigger or tender point, and then shorten the muscle around your fingers, so get her to laterally flex and rotate towards where your hand is, and then hold for 90 seconds or until you feel the muscle soften under your fingertips or the client tells you it's relaxed. For muscle spasm treatments, I don't like to put a lot of oil on. I want a little more traction in all of these techniques because I want to hold them. You can slip out if you have too much oil on your hands. So do some upper trapezius stripping. So here I'm bringing the tissue down and back, reducing that forward head posture. And then I'm just moving at the rate at which the tissue allows me to move. Now, after you've done all of those different techniques, one thing you could do, especially if it's more of a chronic situation, or it was spasming that they had earlier in the week, or you've reduced the spasm during the treatment, is a muscle energy technique. Get them to contract their head and their shoulder together, trying to squeeze them together. Then get them to relax, take a deep breath in and out. And then once they've done that, you can bring the shoulder down and rotate the head away and laterally flex it slightly. So you're bringing their nose into their opposite armpit, and then create a stretch in that area, holding for 15 seconds. You want to repeat this technique 3 times, and then on the final stretch, you want to hold for 30 seconds. A technique that's going to work really well for preventing future muscle spasms is going to be kinesiology taping. You're going to cut 2 Y strips down the middle, and then you're going to round the edges of the Y portions of the tape and the big portion of the tape. You're going to make sure that it fits across their shoulder. We're trying to get this in the upper trapezius and levator scapula. Get the client to rotate their head with their nose going into their opposite armpit. Then lay the anchor point down with 0 stretch on the shoulder. Then break the paper backing off the tape and lay it down just underneath the hairline beside the cervical spine in the upper trapezius. KT tape is going to apply a gentle stretch to the skin and underlying tissues, which can relieve excessive tension in the affected muscle, and it's also going to help to reduce contraction intensity by providing relief for muscle spasms. Lay the other strip down right beside that strip with little to no stretch, and then you're going to rub the tape to make sure it adheres to the skin. Now with the other tape strip, we're going to do something a little bit different. So we're going to break the paper backing off of the anchor point just to get that ready. And then once you've done that, you're going to take their shoulder and you're going to bring it back into a proper postural alignment. You want to make sure that they still have their nose going into their opposite armpit to place a stretch in the area. Then you're going to lay the anchor point down in the shoulder. And then now, this time with 80% stretch, you're going to lay the strip across the upper and middle trapezius and do the same thing with the other strip. The tape is going to stimulate sensory receptors in the skin, which is going to alter the nervous system's input to the muscle. This is going to help reset the muscle, calming overactive muscle fibers and reducing spasm intensity. Lay that final strip down and then rub the tape to adhere it to the skin. And then ask the client if it's feeling comfortable. And then leave the client to rest.